What is a bee sting? A bee sting is a painful injury that happens after a bee pierces your skin and injects venom. You can treat minor bee stings at home. Sometimes, your body can react negatively to a bee sting, and it causes a severe allergic reaction that requires immediate medical attention. Pay attention to your surroundings to prevent bee stings. Bees aren't aggressive insects, but they can sting when they feel threatened. Only female bees can sting. What are the symptoms of a bee sting? Symptoms of a bee sting include a sharp, burning pain at the site of the sting, skin discoloration surrounding the sting, swelling of the affected area, itchy skin. How to treat bee sting? To help alleviate the panic, it's important to know what to do, and not do, to treat a bee sting. The first thing to do is to get the stinger out quickly. The longer the stinger stays in the skin, the more venom it releases, adding to the person's pain and swelling. To treat a sting from a bee, wasp, or hornet, dermatologists recommend the following tips. Stay calm. Although most bees usually only sting once, wasps and hornets can sting again. If you are stung, calmly walk away from the area to avoid additional attacks. Remove the stinger. If the stinger remains in your skin, remove it by scraping over it with your fingernail or a piece of gauze. Never use tweezers to remove a stinger, as squeezing it can cause more venom to release into your skin. Wash the sting with soap and water. Apply a cold pack to reduce swelling. However, if the swelling moves to other parts of your body, such as your face or neck, go to the emergency room immediately, as you might be having an allergic reaction. Other signs of an allergic reaction include difficulty breathing, nausea, hives, or dizziness. Consider taking over-the-counter pain medication. Bee, wasp, and hornet stings are painful. Painkillers like acetaminophen or ibuprofen can help relieve the pain. Always follow the directions on the label and use the correct dose. Neutralization reaction for bee sting. This reaction between acids and alkalis is called neutralization. Bee stings are acidic and are treated by neutralizing the acid with a mild alkali, such as bicarbonate of soda. Wasp stings are slightly alkaline and are treated by neutralizing with an acid, such as vinegar. Thanks for watching.